Many reports have been reported today actually about which patients can stop and cannot stop therapy when receiving oral tyrosine kinase inhibitors for chronic myeloid leukemia. And the most variables that were associated with a successful treatment discontinuation and treatment-free remission, thereafter referred as TFR, are the duration of TKI therapy, the depth of response achieved, and the duration of the response. So we tried to analyze this at MD Anderson, and we looked at a cohort of patients on over a period of around 20 years who discontinued therapy for many reasons, either elective discontinuation, adverse events, or others. And those patients were in very deep molecular response before stopping therapy. And we followed them in time to see which were the patients who had lost their response, defined as BCR-ABL, PCR level above 0.1% at any point during follow-up. And we conducted a univariate and multivariate analysis to see what are the factors that are associated with a successful treatment-free remission. So the characteristics of our patients, the median age as expected was 63 years. Most of the patients, 84%, were either low or intermediate risk by SoCal. Imatinib was the most frequent frontline TKI used, 37%, followed by Dasatinib, 29%, and Nilotinib, 26%. One-third of our patients, 32%, had received 2 different TKIs or more throughout the course of therapy, either because of intolerance or disease resistance. The median time on therapy was 117 months, which is around 10 years. The median duration in MR4, which is 4-log reduction of the BCR-ABL transcript, was 74 months, around 6 years. And the duration in even deeper molecular response, MR4.5, which is 4.5-log reduction of BCR-ABL transcript, was 65 months, which is around 5 years. So in the entire cohort, we had 53 patients among 284, which is the total number of patients that we had who lost response, which translates to an estimated 5-year TFR rate of 79%. Now let's look by duration of by the rate and the depth of the response. So in patients who had MR4.5 for 5 years or longer, had a very high chance of having a successful TFR at 5 years of 87%, compared to 76% in patients who had an MR4.5 duration of less than 5 years. If we look at a deeper level of at a deep level of MR4, we can also observe a similar trend with patients who have a MR4 duration of 5 years or longer having a successful TFR on the long run of 88%, compared to 64% in patients who have a MR4 duration less than 5 years. And also we looked at patients who were in deep molecular remission for a long time, mostly MR4.5, but had like one single PCR fluctuation, single positivity value that remained in the MR4 range. And we wanted to see if those patients did worse or better. And in fact, we saw that those patients did absolutely the same, whether they were consistently in MR4.5 or had a small fluctuation in the MR4 range, with similar rates of 88% and 83% of TFR at 5 years. We also looked if the type of frontline tyrosine kinase inhibitor differed and induced different TFR rates on the long run. And in fact, we saw that this was not the case. Patients treated with any first, second, or third generation. In fact, we had a few patients treated with Ponatinib early on, and most of the patients had very similar 5-year TFR rates ranging between 70 to 80% at 5 years. Some previous reports also mentioned that maybe patients who stop treatment because they want to stop it, or their physician advised them to stop without having any side effects, did better than patients who had adverse events. And in fact, we did not show this in our analysis. Patients who stopped TKI who had elective discontinuation had a 5-year TFR of 82% compared to 80% of patients who had stopped treatment because of adverse events. And when we put all those previous factors in multivariate analysis, the only two factors that showed to be independently associated with a better treatment-free remission were the duration of MR4 above 5 years and a duration of MR4.5 above 5 years. What happened to those patients who relapsed? In fact, all of them, except of one, regained MMR, major molecular response, and more than 90% of the patients achieved a very deep molecular response of MR4.5 or below, with a median time between 3 to 6 months. So take-home messages: the duration of deep molecular remission, MR4 or MR4.5, for 5 years or longer is the most important factor for a successful TFR above 85% at 5 years. The type of frontline TKI or the reason for discontinuation did not impact TFR. Also, a single PCR fluctuation levels between MR4 and MR4.5 also did not impact TFR. And for patients who have an MR4 duration below 5 years, they also had a 5-year TFR, which was also good, 64%, and it could be considered also in some patients. This strategy seemed safe, with most relapsing patients regaining very deep molecular response, MR4, MR4.5, and more than 90% of the cases in a median time of 3 to 6 months.